being a detail-oriented person can definitely land you well. It doesn't matter that what the subject is. Ask every question. Don't accept everything. Just really ask.
A lot of students, especially across the United States, they just think doctor, right? They don't know the range of opportunities that are out there for someone.
And then you cannot graduate without having a really good, meaningful research outcome. Dedicated, if you are having hands-on, depends on the nature of the research and the science you're working on. They have to have a passionate and patience. It really depends how fast you can finish your PhD. That is 5 years of your life that you are dealing with one question.
Okay, welcome back to the Supported Learning Podcast. I'm your host, Dr. Joe Sebastian. Have a special guest today. Dr. Soulmaz from the Mayo Clinic is joining us on the Supported Learning Podcast. Welcome, doctor. How are you?
Good, thank you. How are you?
I am doing well. I'm glad we could fit this in. I know Minnesota doesn't get much sunlight many days of the year, so you're enjoying that out there, right?
Yes, we are here, definitely. In March, it's very rare to have this weather.
Yeah, absolutely. So you got July and winter out in Minnesota. But I want to give you a proper introduction. You work for one of the most elite educational institutions on the planet, the Mayo Clinic. We want to get into what you have learned about teaching, mentorship, and preparing other future students for the world of medicine and medical practice. And, I'm very thrilled to have you because you hold a PhD in biomedical sciences. You started your educational career guiding students through complex lab protocols at Durham University in England, spent years at Mayo Clinic College of Medicine and Science, managing educational programs, developing talent, and understanding what it takes to succeed at the highest level of STEM. And you now work at the Mayo Clinic Platform team, teaching the intersection of AI and healthcare innovation. And how topical is that for us here today? Welcome to the show.
Thank you. Thank you so much for having me.
So how do you get to where you are today, taking that journey? Because most families out there, when they hear medicine, they just think medical doctor. But you're on the research side at the Mayo Clinic doing some very important work. Kind of take me through the journey of how you got there. What sparked your interest, and how did you end up in Minnesota of all places?
Yeah, thank you. I have to go back 2 years back around right after finishing college. When I finished college, I always knew that I want to do a PhD. However, I started doing the master degrees in England. And the reason that I started with master in Newcastle, at that time, if you wanted to ever teach at university, there's always some universities, especially in Europe, they do need and they require you to have a master's and a PhD both to be able to be eligible for teaching. I'm not 100% sure about the US, but at that time, master was a must-have before you start your PhD. I started my master's, and my master degree was in industrial and commercial biotechnology. After I finished my master, it was during the final dissertation of the master that we had to write a project. And I have to mention that doing a master degree in England, it was not easy because a 2-year course was really a very express way into a year. And then I remember that after Christmas holidays and after Easter, we had so many exams, one after each other, a written exam and also so many assignments to submit. I do remember being at the library, looking out the window, sunset and sunrise. We were just like seeing it and just still typing. Those are the very, very, very highly stressed type of master degrees in England. If anyone is considering a 1-year master, you have to be ready to face those type of pressure. After I finished my master, I think the very, very key component within my career, and I would definitely consider that as my educational journey, because I was a freshly undergrad, started my master's. I didn't have any experience. I didn't have any real actual work experience. I finished my master's, and most of my classmates, they started maybe traveling or they started looking for jobs. They were not super successful. What I did, I reached out to my mentor that I did my project in her team. I told her I would like to start learning at least 5 new skills by the end of the summer. So that year, that summer, I planned to volunteer working in Newcastle University. And I invested 3 months of volunteer work in the lab. And I was a really master. At the end of the summer, I learned at that time was proteomics, running 2D gels, Western blot, running PCRs, very, very independent and very masters on those technical aspects. Around the same time, there was a job advertisement came from Newcastle University. I applied for that job. And the unique position that it really uniquely positioned me to get that job, it was a very normal technician job, but it was a very unique technique that I learned, that 2D gel for the proteomics lab. So not that many people at that time, I'm talking about maybe 2008, 2007, not that many people really knew how to run a 2D gel and how to pursue those type of lab experiment. I was one of maybe 2 or 3 people within Newcastle University who that experience, and I got the job. When I started working, I was very closely working with PhD students, with postdocs, with masters. I always, as I said, I always knew I want to start my PhD. And that positioned me as started after 2 or 3 years of working, 2.5 years of working. I started also looking for positions and opportunities. And Durham University had a full ride scholarship for PhD in notch signaling pathway and skin wound healing. So that positioned me in a situation that I had a great lab experience. And I wasn't like any other freshly starting PhD students. I didn't need to learn any of those techniques. I was really well positioned to start a good PhD. And that was the start of my maybe professional journey from Durham University at that point.
Got it. So you then get into the Mayo Clinic, correct?
So no, I finished my PhD at Durham. And
okay.
Durham University in England is a sister of Oxford and Cambridge, and Durham is also on a college base. So I was part of the Ustinov College at Durham University. And Ustinov College at that time, they gave us a scholarship that I could travel and I could go to any conference or seminars. At that time, I remember I had 500 pounds, British pound. It was maybe equivalent. The value was way higher. Maybe it was at that time equivalent to $800 to $900. And then I got that scholarship from Ustinov College. And then I started looking for the area for all these summits all around the world that are interested to me. I found about World Stem Cell Summit. And it was also recommended by one of the professors that I used to work on a project in King's College. He mentioned that maybe that's a great place if I want to look for careers outside of the United Kingdom. And I applied. I reached out directly to the main chair of that summit. And I remember that when I reached out to him, I said, I'm a PhD, just graduation. I was just actually writing my thesis at the time. I said, I am not graduated yet, but I am submitting my thesis within next few months. I am looking for an opportunity if you have any room, any space for the students in your summit. And he very kindly offered me a very great discount for that big summit. I entered into that summit. I had a poster to present as well. And then I wasn't quiet on that summit. I started going session by session. I do remember every morning from 7 a.m, I had my day's planned ahead. So I knew exactly which talk I am going to watch. I am going to listen to this talk. At the end of each presentation, I started speaking to all those speakers. I knew the area of my interest. And at that time, I reached out to one of the speakers. He was a cardiologist from Mayo Clinic. The area that he was presenting was very close to my area of research, my years of experience at Newcastle University, the GMP, good manufacturer practice experience that I earned during the years at Newcastle University. I reached out to him after the talk and I said, I am a PhD. I have these years of background. And we started talking about my project. And I said, can I grab your time during the coffee break? I would really like to see if you have a room in your lab for a PhD postdoc. And then he said, sure, yeah. He gave me about 10, 15 minutes of his time that day. When I talked to him, it was very interesting to him that I had the GMP, good manufacturer practice background. Then the next day, when I was presenting my poster, that physician stopped by my poster with another person from Mayo Clinic, and they started talking about my background at Newcastle, my PhD in regenerative medicine. And they started talking to me and they said, would you consider a postdoc at Mayo? And that was the very first time that I heard Mayo Clinic name. And I started looking into it and I was so thrilled and excited. Around the same time, I had another offer within the same conference. I also met another professor from Children's Hospital in LA. I had another job offer and another professor from Toronto University. So that was the maybe networking and communication skills that I really put all my effort. I studied their papers. I read about their research. I read about their area of interest, and I individually kept, like within the conference, I targeted them. I started having a conversation. When you start a conversation and when they know that we read their papers, you know, their area of research, that's a great initiation for a great conversation. And then, yes, within all those offers, I accepted the Mayo Clinic postdoc. Then I came to Mayo for my official interview. And then I started my postdoc journey in October 20th, Mayo in Rochester, Minnesota.
So getting to the Mayo Clinic, what is their approach on how they look at education and implementation of learning across the medical field? Because you kind of made that switch to more the administrative side of education and research. How do they approach education at the Mayo Clinic?
So your question is how Mayo Clinic approach education or how?
Mm-hmm. Yeah.
So Mayo Clinic has 3 different shields. If you have seen Mayo Clinic's logo, it has 3 different shields on the logo. These are education, research, and practice, the clinic. So education is a very important part of the Mayo Clinic, is one of the shields. And Mayo Clinic has a medical school. Mayo Clinic research and education has always been a very important part and a body of Mayo Clinic that has driven Mayo as an academic institution. Mayo Clinic education and shield, it's not only for students and for medical students and the researchers, it's also for the staff as well, for providing so many different ongoing educational courses. And it has been always very highlighted and very acknowledged within Mayo. As a student, as a medical student, there are so many PhD programs as well that Mayo Clinic offers. Maybe not everyone is aware of those. There is also a very great program, MD PhD, at Mayo Clinic. I don't know the exact administration process and admission for that program, but it's a very long process that you can start. If you can get into that program, it's a very long journey, but you will be an MD PhD. And that's something that Mayo Clinic also offers.
So for a student out there that's looking to go the medical route, but really doesn't have an idea, because I mean, a lot of students, especially across the United States, they just think doctor, right? They don't know the range of opportunities that are out there for someone who is more analytical, that might be into the research and at the cutting edge of driving healthcare in a different factor. What would you say to them in terms of what is important to kind of analyze and really grasp an understanding of how they should pursue seeking something in medicine?
That's a great question. So when we are talking about something in medicine, if they want to be a medical doctor versus a researcher and having an educational path or academic path, I would call them PhD doctors versus MD doctors, or in the other way, you know that the PCR or CPR, we just sometimes also we can call them CPR and the PCR doctors. So when you are looking into academic and being a PhD, your lifestyle, your process, your everything will be different. So definitely a medical doctor requires for you to go to medicine, to start practicing medicine, to go to residency, to go to fellowship. It's a very different path for getting into the research. If you want to get into the research, if these people are really looking into the research, they have to have a passionate and patience for the research, because research is something that during a PhD, you will be given a hypothesis, a question, that question within the 5 years, it really depends how fast you can finish your PhD. That is 5 years of your life that you are dealing with one question, one area of science. Your life will be dedicated if you are having hands-on, depends on the nature of the research and the science you're working on. It could be working in a wet lab. You have to put yourself in a situation that your life will be 5 to 6 years working on a project in a lab with the same people, with the same professor, with the same environment in the same location. And then you cannot graduate without having a really good, meaningful research outcome. It could be a paper, it could be anything, but then you have to dedicate 5 years of your time into that area. If it's neurology, cardiology, whatever it is, you are dedicating your life into that area. It's very different. The journey, it's very different compared to going towards a medicine. But when you become a doctor, when you are working on a PhD program, it doesn't mean that when you have your PhD, for example, my PhD is in skin wound healing and working on one specific signaling pathway on a skin wound healing. The PhD program trains you and teaches you how to answer a scientific question, how to plan around it, how to plan experiments around it, how to help others to pursue any scientific questions. So it doesn't mean that if you do your PhD in cardiology, you have to always pursue something in cardiology area. You can be more flexible and you can start teaching. You can start working in so many different areas. But pursuing medicine in cardiology, if you start a residency in cardiology, dermatology, or neurosurgery, you have a narrower vision and it becomes narrower and more specific into that area. But being a scientist, being a PhD, it gives you more option, in my opinion. If you haven't narrowed down yourself into that one area specific, that gives you more option and more flexibility. And the route I took, it was also not only the science, but I also started looking into the area of FDA and the regulatory as well. That was also something that alongside with my PhD, I took some courses at FDA and NIH, and that certified me as a GMP, good manufacturer scientist, that it's really something that we can pursue so many different industrial positions as well. So that's also another open door, that you don't need to work in a hospital setting. You don't need to be an academic setting. You can work for a pharmaceutical company. You can be a scientist for a drug or a device company.
Gotcha. Okay. Well, let's leave it with this because I know unfortunately we're short on time. So I hope you'll come back. What is the number one skill? I want to say this. What's the number one skill a high school student should have if they're going to pursue anything in the medical field in 2026?
If you want to become either a physician or a scientist, I would say as a high schooler, be very detail oriented. Just even if you are reading a very simple biology text or anything, just look into all the details. It doesn't matter that what the subject is. Ask every question. Don't accept everything. Just really ask all those details around that single task and questions or anything. Being a detail-oriented person can definitely land you well, because that detail, if you are in medical school or if you become a scientist, without paying attention to details, you can't be successful in either of those.
Amazing. Dr. Soulmaz, thank you so much for joining us on short notice. I appreciate it.
Sorry about the technical issues I had at the beginning.
No worries. It's okay. Let's come back and potentially have a deeper conversation and maybe talk a little bit more about AI. All right?
Absolutely. Happy to. Thank you.
All right. Thank you so much. And thank you for joining the Supported Learning Podcast.
I appreciate it. Thank you so much for having me. Bye.
Absolutely. Bye.